Hello, YouTube. It is Dr. Tanya Lambert here, your fibroid health and wellness advocate. So the purpose of my channel is to share high quality information to help women with fibroids and their families so that they can find high quality holistic health information to help them on their natural healing journey. So before we get started with this video, I would like to give my disclaimer. The information provided in my videos are not intended to substitute medical advice. The information is purely educational and informational. Please continue to see your licensed healthcare provider for all of your healthcare needs, and just know that the information that I provide is not to be used to diagnose, treat, or cure any disease. So with that being said, let us get into today's video. Now it is July 2023, and welcome to Fibroid Awareness Month. And I know that you're seeing a lot of posts about fibroids and also various types of information about fibroids. But during this month on the Lambert University channel, we're going to be talking about practical steps to help you get to the root cause of the fibroids so that you can choose the best methods to help you shrink them naturally, or using the methods of choice that you work on with your healthcare provider. Now, I have been speaking to many of my followers, and many of the women are interested in learning about high quality clinical tests to help you to get to the root cause of fibroids, which is so very important. Now, one of the issues that women with fibroids have is that they tend to be bombarded with information about supplements, herbals, and even remedies to help them to shrink the fibroids. However, sometimes those remedies may not be as effective for one woman compared to another woman. And a reason for that is because you haven't gotten to the root cause. You may have also heard that estrogen dominance is the main root cause of fibroids. Now, there's definitely truth to that, as estrogen dominance does contribute to fibroid growth. But for some women, they may find that when they go to their healthcare provider and get their hormones tested, that their estrogen levels are normal, which poses the question of what could be causing their fibroids in the first place. And for other women, they have tried a variety of different herbal remedies, supplements, and also herbal treatments, and have not seen any relief from the fibroids. So it is so important that you learn about clinical tests to help get to the root cause, so you're not wasting your time, but rather you're making practical decisions to help you to heal. Now, over the next several videos during this month, I will be sharing with you practical tests that you should consider speaking with your physician about ordering to help you get to the root cause of the fibroids in your womb. For you to make proper health decisions regarding your health with your healthcare practitioner, you must know how your body works. You must also know what clinical tests are available to help you understand how your organ systems work. And then once you get that information, you can then work with your healthcare provider to choose the best options for you to help you to heal. Now, over the next several weeks, the structure of my videos will be as follows. We will first learn about the organ systems that are involved in the development of fibroids. You will first learn about how that organ system is designed to work properly when you are healthy. And you will also learn how the breakdown in that system can contribute to fibroid growth. We will also talk about clinical tests to help you understand where in the system is that breakdown, as well as lab values to help guide you on whether or not a lab value is normal or abnormal. And finally, I'll also share with you practical tips on how you can get your hormones back in balance. Now, this week, I would like to share with you the importance of having your thyroid gland thoroughly tested. Now, many women are not aware that when their thyroid gland is not functioning properly, that it can contribute to fibroid development and growth. Now, your fibroid is a small butterfly-shaped organ that is located in the lower portion of your neck. Now, this gland is incredibly valuable to keeping your entire body working well. Number one, the thyroid gland is going to produce thyroid hormones that are going to help to regulate your metabolism and help you to maintain a healthy weight. Thyroid hormones also contribute to the proper functioning of your heart, allowing for you to have a healthy functioning heart and heart rates. Also, the thyroid gland is responsible for helping you to regulate your bowel movements and also the rate at which food is processed and moves through your small and your large intestine. The thyroid hormones also regulate your body temperature and even help you to maintain healthy skin and bones. In fact, the thyroid hormone is going to determine the rate at which your cells are broken down and then built up again. And last, but certainly not least, thyroid hormones help to regulate your menstrual cycle and fertility. So when your thyroid hormones are not properly imbalanced, or when they're too high or too low, that can negatively impact your menstrual cycle and also reduce your ability to conceive a baby if that is your goal. Also, hypothyroidism can negatively impact your fertility. In fact, when your thyroid hormone levels are low, this can interfere with your pituitary's ability to release hormones that promote ovulation. This can also interfere with your ovaries' ability to produce mature eggs, which can allow you to conceive a baby. Additionally, hypothyroidism or low thyroid hormone levels contribute to a condition called insulin resistance, which can increase your risk of or worsen a condition called polycystic ovarian syndrome or PCOS. Another issue with having low thyroid hormones is that it can reduce your liver's ability to metabolize estrogen, resulting in a buildup of estrogen in the body, also known as estrogen dominance, reduced progesterone levels, which contributes to fibroid growth, heavy periods, and infertility. Now, ladies, it is so important that you understand that the regulation of your thyroid hormones begins in the brain. Now, the brain is known as the most powerful sex organ. At the base of the brain is a small structure called the hypothalamus. The hypothalamus is going to talk to another structure below it called the pituitary gland. The pituitary then sends out hormones that talk to the thyroid and stimulate it to release thyroid hormones. In medical school, they gave us a very simple phrase to help us remember that the hypothalamus is going to tell the pitu what to do. So the hypothalamus is basically the regulator that sets up when certain hormones are released throughout the day and even throughout the month, which also helps to regulate your menstrual cycle. So let's dive a little deeper and learn about the hormones that are produced at each level from the hypothalamus to the pituitary and then to the thyroid gland. So with the hypothalamus, it produces a hormone called TRH. That hormone is also known as thyrotropin releasing hormone. So when you see the R, just think releasing. This releasing hormone is then going to act on the pituitary to release another hormone called thyroid stimulating hormone, also known as TSH. So think of the stimulator. This stimulating hormone is then going to act on the thyroid gland, and the thyroid is going to produce thyroid hormones, particularly T4 which is the inactive version of thyroid hormone, and to a lesser extent, T3. T3 is the active form of thyroid hormone. When you go to the doctor and get your thyroid levels checked, the two main hormones that are checked are thyroid stimulating hormone and T4. Sometimes they only check TSH. Now, this is an issue because it doesn't give the full picture of how your thyroid gland is working. So overall, when you go to your healthcare provider, he or she will typically test for two thyroid hormones, particularly TSH and T4. And sometimes they only test for TSH. Now, the issue with this is that it doesn't give a complete picture of what is going on with your thyroid hormone or your thyroid health. It is so important that when you go to your healthcare provider, that you ask them to do a complete thyroid panel, looking at TSH or thyroid stimulating hormone, total T3 and T4. So that includes the free forms of thyroid hormone and those that are bound to proteins circulating in the body, as well as the free forms of T3 and T4, and even a hormone called reverse T3, which prevents T4 from converting to the active form of thyroid hormone, and even antibodies for autoimmune disease of the thyroid gland, including thyroid peroxidase antibodies and thyroglobulin antibodies. Having all of these values tested is very important to helping you get to the root cause of what can be going on with your thyroid. And when you understand what is going on with your thyroid gland, if you have fibroids, this can also better help you determine why you had the fibroids in the first place, so that you can develop a proper course of action with your doctor to help you get well and shrink the fibroids naturally. Now, I want to share with you some very valuable information as it comes to getting your thyroid gland checked at a conventional medical practice versus a functional medical practice. Sadly, millions of women are walking around with a form of hypothyroidism called subclinical hypothyroidism, and they don't even know it. They may get their thyroid hormones checked at their healthcare provider, but they hear that their thyroid hormones are normal, and yet they still have symptoms of fatigue, low sex drive, constipation, dry skin, and even hair loss. And so on this slide, this is what I want you to focus on. With conventional labs, the main focus is to diagnose disease, not to catch disease before it begins. Three of the hormones that are more commonly tested for the thyroid in conventional medicine include TSH, T3, and T4, but particularly TSH and T4. Now, what's interesting to note is that in conventional medicine, the normal values for TSH, which is the thyroid stimulating hormone, is 0.4 to 5.0 milli-international units per liter. But if you take a look at TSH from a functional medicine perspective, the normal range is 0.5 to 2.0 milli-international units per liter. Now, why is this important? When it comes to your laboratory values, many times the normal values or ranges are going to vary from laboratory to laboratory. Also, in the conventional medicine practice, the normal thyroid hormone levels are actually based on individuals who are already sick. So your normal value might not be normal for you. From a functional medicine perspective, the TSH values are narrower. So as you notice, TSH ranges from 0.5 to 2.0. So in this case, if your TSH value is, say, 3, that could indicate that you do have subclinical hypothyroidism. And if you were to find this out sooner, then you can work with your medical practitioner to improve your diet and your lifestyle, and also get on the right supplementation in order to reverse the thyroid issue. Also, you will notice similar differences between the total T3 values in conventional medicine being between 80 and 220, and functional medicine being between 100 and 180, and also somewhat similar with the total T4, although the values are very close in range. But ultimately, we want to make sure that you are getting your thyroid hormones properly tested so that you can support your thyroid adequately, which will help you get on track with healing naturally from fibroids. So ladies, this brings me to the end of this video, and this is what I want you to do if you are suffering from uterine fibroids. Get a complete thyroid testing panel done. Make sure that when you get your thyroids tested, that they not only look at the thyroid stimulating hormone or TSH, but they also look at the total T3 and T4, the free T3 and T4, the reverse T3, and also thyroid antibodies. You may speak with your conventional medical doctor about getting these tested, but typically you're more likely to get this comprehensive thyroid testing done by a licensed functional medical physician, naturopathic doctor, or even certain chiropractic offices. So it's very important that you know what your options are, but most importantly, understand how your body is working so that you can make the best decisions for you and you're not shooting in the dark trying different herbal supplements that aren't working for you. It will save you a lot of time and a lot of money. So ladies, we have now come to the end of this video, and I want to leave you with this Bible verse from Proverbs 18, verse 15. And it says, "The heart of the prudent acquires knowledge, and the ear of the wise seeks knowledge." So, ladies, you want to be cautious and you want to be wise. You want to keep your ears open and seek out the right information to help you to get to the root cause of the fibroids so that you can make the best decisions for your health. Because many times it is the lack of the right type of knowledge that prevents us from getting the help that we need. So I hope you've taken notes in this video of what your next course of action should be when you talk to your healthcare practitioner about the thyroid test that you should consider ordering, and also what your next step should be when you get those results. All right, LU family, I totally appreciate your time. Thank you for watching this video. If you have any questions or comments, leave it in the comment section below. Also, if you like this video, don't forget to give it a thumbs up, share it with your friends, subscribe to the channel, and I will see you next time. So next week, get ready. We're going to be talking all about estrogen and also the best test to help you understand what is going on with your estrogen levels so that you can learn how to properly balance your estrogen. Because it's not about attacking estrogen, sisters. It's about understanding what is going on with your hormones so that you can balance your hormones so that your body can function properly and you can heal from fibroids. Take care of yourselves, and I'll see you in the next video.